essential hypertension of the young. So that is the change last 10 to 20 years that we are seeing. So what is the pathogenesis? What is the pathogenesis in primary hypertension? Though kidney disease can cause secondary hypertension, but even in primary hypertension, there are some pathogenic mechanisms like renal dysfunction and peripheral vascular resistance and endothelial dysfunction, the vascular endothelial dysfunction and autonomic dysfunction. These are the probable explainable mechanisms involved in the pathogenesis of the primary hypertension. Insulin resistance also is one of the causes of hypertension. And same thing, we have neurohormonal mechanisms. It's a multi-factor because we don't know what is the exact cause of the etiology of hypertension. We postulate many different mechanisms, different theories, but then it could be a multifactorial also. So 40 to 60% of the essential hypertension patients are because of genetic predisposition. They have genetic connection which is causing hypertension in this 40 to 60% of the people. And in remaining people, it is environmental. When I say environmental, what I mean is their dietary habits like high salt intake. People who take more salt are more prone for. Asians, Indians, we eat more salt than it is necessary compared to the Westerners. Actually, we should take less than 5 grams per day, each individual. Less than 5 grams is roughly equal to 5 pinches of salt. From morning till evening, 24 hours, we should not eat more than 5 pinches of salt. But ultimately, we eat a lot of everything like a big thing like biryani and other things, which contain a lot of salt. And even the tinned food like potatoes and pickles, they contain a lot of salt. So Indians basically we are more salt eaters. So therefore, we are more prone for development of hypertension. So in environmental factor, not only the salt intake, but also obesity and lack of physical exercise and increased alcohol. People who take excessive alcohol are also more prone for development hypertension. People who take less quantity in moderation, they may not develop. In fact, they say that it's beneficial. Tell them to keep silent. So obesity and alcohol, yeah, excessive people who take excessive alcohol are also at risk of development of hypertension. So what is hypertension? When do you call? What is hypertension? What is normal breathing? What is normal blood pressure? What is hypertension? Can someone type? What is normal blood pressure? What is hypertension?
Above 140/90 hypertension.
Above 140/90. Yes. Individualized. Yes.
120/80 optimal blood pressure.
Okay. It is like this. It's a big story. The journey of the definition of hypertension is there's no final answer yet. The last we know blood pressure for last more than 300 years. Blood pressure, but till today we don't know what is normal, ideal normal blood pressure, because every time it keeps changing. We have different authenticated bodies give us directions, guidelines to what is the definition of hypertension, what is the treatment of hypertension. We have Indian hypertension guidelines, we have American hypertension guidelines, we have European, we have so many guidelines available, so many definitions of hypertension. So Indian Hypertension Society guidelines are also there. So every time it keeps changing, and worldwide a very highest authenticated body is your Joint National Commission, JNC. The JNC every 4 to 5, 6 years, they pull in all the data available from the entire world, and they give the new definition of hypertension and how much have to be treated, what is the treatment protocols. So every time it keeps changing. Last JNC was about 6-7 years back. I don't know when the next guidelines will come. Till that time, we have Indian, because our ethnicity is different, our requirements are different, our body structure is different. So our Indian guidelines are there, beautiful Indian Americans, Indian hypertension guidelines, we can follow those things. They will suit more to the Indian patients. So I'll put a slide here. It is given in all the books, and what is hypertension, what is normal, what is optimal, what is high normal, so what is hypertension. If you can see this small table.
Not able to present. Sagar, can you make me the presenter? Sagar, please make me presenter. Not able to share the screen. Which one?
Yeah, if you can see this now, it is self-explanatory. The definition of hypertension, what is the optimal, what is normal, what is high normal. Optimal is less than 120 by less than 80. Normal is less than 130 by 85. High normal is between 130 and 139, and diastolic 85 to 89. That is the category. In hypertension, we have grade 1 to 3. Grade 1 is 140 to 159 systolic, and 90 to 99 diastolic. Grade 2 is moderate hypertension, 160 to 179 systolic, and 100 to 109 diastolic. Grade 3 is severe. We have more than 180 systolic and more than 110 diastolic. Isolated, we have other categories like isolated systolic hypertension, isolated diastolic hypertension. When only systolic or only diastolic elevated, we have this kind of special category of hypertension. So every time the definition changes. Now, as of now, this is the definition that we are following. So stress, BP is high in the hospital. We check the blood pressure, it is high. They say, no, I'm stressed for last 2 days, 3 days. I had some issues in the family or in the office. That's why I'm having high blood pressure. But stress, how much it really contributes to the production of the high blood pressure, hypertension is still a debatable one. The role of stress is not clearly understood, and it's not confirmed, it's not proved that stress will cause hypertension. Actually, measurement of blood pressure is, again, it's a big topic. There was a recent article in JAPI about a six-page article on how to measure the blood pressure. The pediatric, adult, obese patient, different sizes of cuff, different sizes of BP apparatus. You have to have a good cuff, and you have to cover it at least 3/4 of your arm circumference. And patient should be